introduction, and thank you for the opportunity to present this work. And thank you, Bai, for the initial presentation to the work and the cohort we have been working with. So, as we saw in the first section, in the first section of the conference, new approaches, especially for developing countries, and that might be cheaper and accessible to communities that are not that comfortable with the new therapies that are coming up, might be still an option. And in this context, we are trying to develop microbicides able to prevent sexually transmitted infections via vaginal or rectal, so sexually transmitted diseases. In this sense, we are working with dipeptide WAM, tryptophan glycine, that it was found in this cohort in which we performed metabolomics and transcriptomics in fecal samples and plasma, and we found that a set of 17 dipeptides were highly enhanced in the elite control group compared to their two groups. They were present in their two groups, but really, really enhanced in the elite control group. And when we did study the antiviral activity of these dipeptides, we found that one of them, WG, was really good inhibiting HIV infection initially in vitro. We studied how it was inhibiting the infection, and we found that it was able to bind to the CD4 binding pocket of the GP120, and it was able to inhibit the entry of the virus into the cell by blocking the attachment. And also, when we were allowing the virus to go inside of the cell by doing first treatment and removing everything, all the dipeptide, and only the dipeptide that was inside the cell was exerting an activity of inhibiting the infection, we saw that it was also having an effect on the retrotranscription of the HIV. We published this a couple of years ago. You can check this paper if you want more information. And we have been working with this dipeptide since then. We have several approaches in which we try to use WG as treatment in combination with other antiretroviral drugs and see how well they synergy with each other, how well it works against different subtypes. And until now, we haven't found any drug-resistant mutation which the dipeptide cannot inhibit. But getting back to this talk, we are focused on the PrEP potential of this dipeptide, formulated as a topical gel, either alone or in combination with biomaterials, in this sense with mucins-based gels, which we are working on the context of our EU project, the NATPROLUP project, but the data today is only going to be with WG. The model that we use to study the effect of WG as a topical gel is to use tissue samples from hysterectomies from women that get the female reproductive tract removed for mechanical reasons. So the tissue itself is healthy, it's a mechanical problem, and we use it as healthy controls, let's say like that. We process them, and we create several ex vivo tissue models in which we can study the biosafety of this compound as well as the efficacy. We know that a lot of the microbicides that have reached clinical trials has failed due to irritation, toxicity, or even enhance of the immune activation in the vagina, and then increasing the infection because of that, and also the ones that fail because of the lack of efficacy, because of the lack of good models to study preclinical models. When we evaluated WG in this tissue model as a safety model, we saw that different concentration of WG from 5 millimolar to 15 millimolar was not toxic in the 3 days daily application. And when we tested 10 millimolar for 7 days of consecutive application, it was not toxic at all. And also, when we evaluated the antiviral activity of this compound in this tissue model, we saw that it was able to inhibit it between 75 and 80% of the infection, which is a really good data for the compound itself without any other combination. And what we are working right now related to Bai's work is also to study how it could affect the microbiome. We are developing this vaginal on a chip model in which we can also study the effect of the compound in vaginal microbiota. And it's also quite interesting regarding the inflammation that you mentioned in the gut, because we have seen that WG is able to enhance the expression of several time junctions. For example, CD1, Claudin 1 and Claudin 14. We don't know if it's a direct effect of the dipeptide or because it enhanced the growth of several bacterial populations. We have seen that it enhanced the growth of several lactobacillus species. And as you know, lactobacillus produce lactic acid, which enhance time junctions expression. Regarding the immune modulatory effect of WG, we've seen that it does not have any effect on T cells, nor T cell activation. It doesn't have any effect on monocytes or in activation of dendritic cells, and also nothing on neutrophils or on the core receptors expression on T cells, which is quite good. We don't want the compound to be to exert any kind of activation because it's meant to be used in healthy women. And also to study more in depth the dendritic cells, concretely the Langerhans cells, we are developing this epithelial layer model in which we separate the epithelial layer from the rest of the tissue, and we are able to isolate the Langerhans cells from that. And we study how WG affects them in the sense of maturation, but also we want to study how it modifies, or if it modifies, the antigen presentation capability of these Langerhans cells, because they are the one that are the first barrier of protection against the HIV in the sense of the immune system. There is two clear populations regarding Langerhans cells. One that is double positives for CD1A and for Langerin. These are called the more immature ones. They have Langerin that captures the HIV and is able to degrade it via TRIM alpha. Okay, but as they mature or they get activated, they lose the Langerin and they are more susceptible to HIV infection. So we don't go to that way. So this is a pilot study. It's only one patient that I can show you here. And what we did is we studied first the non-treated to study that the model is okay. The zeroed, we made zero the, let's call immature ones, the ones that were isolated directly right after we got the tissue. And then we compare what happens with both populations after 2 days in culture with activation factors. And we saw that both populations were activated and there was a switch from the double positives to the positive negative, the ones that were losing Langerin. And when we added WG, we saw that it was inhibiting or dampening a little bit more, the activation and the maturation of these Langerhans cells. They were kept in the more immature state without losing Langerin, which in the sense of the HIV infection is a good result. So in conclusion, WG has been able to inhibit infection in this tissue model by 80%. It does not induce any kind of activation, which we have also checked in the PBMCs in case it reached the bloodstream. And also initial findings suggest that WG attenuates the activation of maturation of Langerhans cells in this tissue model. And I want to thank my group, all the patients, hospital, and the founding bodies. Thank you.